Hello, everyone. This is infection control, the second part of our lecture for February 14th. We're going to start at this point, which was infection control and practices. As we think about preventing the spread of illness and disease across a population, it becomes pretty apparent in healthcare that we need systems in place to help control the spread of illness and disease and infection. The three principles that we have available to us at this time include engineering controls. So things like negative pressure rooms, airflow, adjusting the environmental humidity can all be part of the engineering controls, using ventilators, ventilation, fans, that kind of thing. The second area of infection control and practice is PPE, or personal protective equipment. And as many of you are very familiar with, we have things like gloves, gowns, masks, suits of different materials and methods to put them on correctly so that we don't spread infection. The third area that we have within our control to help prevent infection spread is practice controls. It's what we can do as people, as humans, to minimize the spread of infection, with hand washing still being a benchmark of infection control process today. Many of you are probably had experiences in clinical where you had to practice precautions with your resident or your patient. And there's a variety of different precautions that we are able to use. Standard precautions, one of the basic pieces of healthcare today. We use airborne precautions, droplet precautions, contact precautions, and it's important that you as a nurse are able to understand and navigate the different types of precautions of when to use them and when not to use them, and which is the appropriate level of precaution for the particular patient that you're caring for. The first step is that you want to be using the highest level of precaution available if you have an unknown infection source. So for example, if a patient presents with symptoms of the flu, for example, that may or may not be a biohazard or a bioterrorism issue. So you'll want to protect the environment by using the highest level of protection for people, and for example, a negative pressure room, full mask, gown, gloves, and all the other precautions that we have available to us. Once the source of infection is identified, then precautions can be adjusted accordingly. For example, with Clostridium difficile, a pretty significant diarrhea type illness, you may want to use contact precautions, which also include standard precautions, and add some environmental factors, such as keeping that person in an individual room or giving them their own commode or bathroom to prevent the spread of infection. Now, the CDC does have guidelines for us to use regularly. I highly encourage you to look at that. When you get a free moment, these infection control guidelines are available to us, and they have a very clear outline of what to do with what situation, including the table that links the specific type of precaution with the patient infection that they have, so that you know exactly what type of precautions to use. It also includes safe work practices, how to dispose of solid waste, dishware, and eating utensils, injection practices, education, and then it gives you a clear outline. For example, this is transmission-based precautions, so you have a good idea, for example, of what's needed. Now, our next slide just highlights the importance of recognition of sepsis and how important sepsis prevention is in preventing unexpected death for patients. And at the core of this particular issue is infection control. So for example, ventilator-acquired pneumonia, central line infections, pneumonia, hospital-acquired pneumonia, all of those infections are preventable if we use good infection control practices. When you get a free moment, I would challenge you to just look at different situations that you might come across in the healthcare setting and make a decision for yourself as to what personal protective equipment you should wear and to what extent. For things such as a wound dressing change, a IV intravenous start, a blood administration product, anything that you normally might come across in the healthcare setting, and double check it against your resources to make sure you are using the correct precautions. So as part of infection control and infection prevention, we want to think about the different levels of prevention. And in public health and community health, we think of 3 different levels. The first level being primary prevention, in which you're actually preventing the occurrence of any disease. Secondary prevention, in which you're preventing the spread of infection or disease. And the third is tertiary prevention, or reducing complications or disability through treatment and rehabilitation. So when we think about the definitions of different types of prevention, there is a nice primer here I would encourage you to read at your leisure, and it's from the Association of Faculties of Medicine in Canada. It gives you a great outline of some of the specific examples of different levels of prevention. So for example, under colorectal cancer, you can have an individual or population level intervention, and it gives you some examples of primary, secondary, and tertiary prevention. I highly encourage you to look at that table and that article so that you're more familiar with the definitions of prevention and health promotion related to infection spread. It is an essential feature of our job today as a nurse, as we look more and more towards public health and population-focused care. So we're going to drill down a little bit on primary prevention, secondary prevention, and tertiary prevention. So in primary prevention, our focus is totally on risk reduction, and we're altering behavior and/or the exposure risks. And primary prevention can either be passive or active. So for example, we often think of primary prevention as preventing illness. So vaccination clinics can be a big piece of primary prevention. Other methods or examples of primary prevention on the community side include things like bicycle safety helmet programs, lead abatement in homes that have children, and even seatbelt laws. All of those prevent the spread of illness or disease or accidents. The secondary prevention level, we want to detect and treat to control the disease from progressing or making the disease get worse. So screening programs are the benchmark of this type of prevention. So when we think of secondary prevention, we might think of all of these types of screenings: a mammogram, a PSA, a colonoscopy, stool testing for blood, pap smears, and preventative health exams. Again, you may have illness or disease. Our whole focus is on preventing them from occurring or getting worse. Finally, tertiary prevention is 100% focused on the impact of the disease process on a person's longevity, function, and quality of life. So the big focus of tertiary prevention is on modification of risk factors. And our hope is that it impacts by individual management. We're also impacting the prevalence of the disease or illness across the population. Some examples of tertiary prevention include smoking cessation programs, cardiac rehabilitation programs, weight loss programs, and diet and nutrition teaching. So I'm going to stop there for this session. We'll probably pick some of this content up in class just as a refresher, and make sure you take the time to really think about primary and secondary and tertiary prevention and link it to other examples so that you're clear on which each level of prevention involves. Thank you so much.